Welcome everybody. I'm Dr. Jeff Abrams of Abrams Chiropractic here in Greenville, South Carolina. And I know a lot of you say, President Obama, Mitt Romney, and TMJ. What does that have to do with anything? Well, TMJ, temporomandibular joint syndrome, is for some of you who experience it. That's for people that have a lot of tension in their jaw, and these people, actually their jawline goes out of place. And so right now, you're probably really stressed out watching the news and reading all the newspapers, if that's even something that you do anymore. And so now you're all tensed up, and so when you clench your jaw, this is going to aggravate the problem. So best thing that you can do is just turn off the news. It'll take care of itself. And then have your husband or boyfriend or spouse help you out and alleviate some of that discomfort with you right now. So I'm going to show you how to do some natural solutions to alleviate some of that discomfort, and Emily is going to assist me with that. So the first thing that you're going to do is put some of these gloves on, and what you're going to do is you're going to go inside the jaw, inside the mouth, and you're going to work your way with the one finger, your first finger, all the way up into where that joint is. And when you find that spot, it's almost like a real, like on hers, it's real tender. You feel that, Emily? Mm-hmm. So once you find that spot, you're going to lightly apply pressure going this way, upward and outward, okay? Like going north and east once you find that spot. And then at the same time, simultaneously, you'll take your other finger and you'll find that joint line and you'll just apply pressure and put pressure on it. Now, there's going to be different motions that you're going to use, meaning you can work your way up almost into the sinus cavities, but then you can work your way down more so into the jawline. And so what we're doing is we're loosening up these muscle points, these trigger points is what we call, of mastication, which is where your jawline and the muscles and the mandible all interconnect. And so you're breaking up all those adhesions, allowing for more mobility to ensue. So you just hold it there for about 30 to 60 seconds, and then you'll move it around. And something else that you can do once you're done with that is what we do in the office is called ultrasound therapy. And ultrasound, what you'll do is you'll take, and I know that you don't have this at your house obviously, but if you come to our office or if you go to a doctor in your area, what you can do is take the gel and you'll put the gel on the outside of her jaw. You can turn your head to the right. Okay, so sorry about that. All right. So you just put a little bit of gel right there. You'll turn the ultrasound machine on and then have the doctor or myself, we will just kind of administer this ultrasound treatment. And what this does is it sends deep penetrating sound frequencies into the muscles, and it breaks up all those adhesions as the muscles and the soft tissue absorb those frequencies as if it were a sponge. Okay? So you'll do this for about 6 minutes or so, and that will break up from the outside, external in, and then you've already worked, if you're working with the inside of the jaw, inside out. Another thing that you can do is, if your jaw just totally locks up, is to take your tongue and put it on your upper palate, just like this, and try to open up your jaw while keeping your tongue at the top of your roof. And then just continue to do that. Open and close, keeping the tongue at the top of your roof, and that will actually help to realign and put it back on track. The last thing, from a chiropractic standpoint that we do, is we use this instrument here, and this instrument we will put on the jaw and actually adjust the jawline back into normal. So I know a lot of you have gone to dentists, and I highly encourage you to do that, to get your night brace, because that'll help to keep things in place while you're sleeping. But having said that, you actually have to take more of a proactive approach and get in there and break up these adhesions, doing something manual, something physical, instead of just taking drugs to cover up the pain. But this will fix your problem. It takes a few treatments back to back over a course of 2 to 4 weeks in order to stabilize out usually. And so hopefully this will give you some positive information tonight while you're under a lot of stress just watching everything, and hopefully after listening to this you'll just take my advice and just turn the TV off, because it'll take care of itself. Thanks everybody for watching, and enjoy your night, and have a good one.